How would a medico actually do well in an MBA or a PGDM program?
So I think that's where doctor or a medical professional would really be benefiting.
An MBBS student basically will always have a negative side to the PGDM life because they are not trained in maths, statistics, or economics.
Yes and no. They do learn.
46% of healthcare professionals are unable to use digital patient data. I believe that's dangerous. What's your opinion about it?
Why is that happening?
What are the lacunas that you have seen through the eye of a management person?
For Indian systems, I think is the processes.
How much can a PGDM or an MBA healthcare earn?
Starting salary would be around lakh per annum.
We are building India's largest community of medicos. But before I go forward, I do have a complaint. 91% of you still not have subscribed to the channel. So guys, before we move forward, please like, share and subscribe. Build this channel with me so that I can get more amazing persons on this podcast to clear all the misconceptions about the medical world. Today's topic of discussion is entrepreneurship and MBA in healthcare for medicos. For years, the medico mindset has been very simple: MBBS, MD, DM, or MCH, and you move on to being an AP or consultant somewhere. But the moment somebody wants to try something new, there's a lot of hesitation. There's a lot of apprehension amongst the society. We have got the best person to guide you whether being an MBA healthcare can actually be a worthy investment. We have Dr. Usha Manjunath with us. She is the director and professor at IIHMR, Indian Institute of Health Management and Research, Bangalore. She is a doctorate from BITS Pilani in healthcare management, a Paul Harris Fellow, awardee of the Indira Gandhi Gold Medal, and the author of Total Quality of Healthcare. With so much accreditation, with so much hard work, leadership, she is the perfect person to help every new medico looking for a new path of healthcare entrepreneurship. So let's put our hands together and let's welcome Dr. Usha Manjunath. Welcome, Dr. Usha ma'am, to the Nachiket Bhatia show.
Thank you.
Ma'am, you are doing something very interesting. We, as your audience here, are very much interested to know that you are saying that, MBBS, MBA, this combination actually works. We'll get on to the digital healthcare part, the AI part for medicos, and the complete set of amazing questions that we have prepared for you. But before going there, I would request you, I want to know everything about Dr. Usha. How did you get into your own doctorate part? How did you get, how did you become the director of IHMR, one of the most prestigious colleges in India? I'm sure it was not an easy way out. So I would like to know everything about you.
Okay, so I suppose it always starts from home. And, coming from a large family, being the last one, my father was a motivator. So he said, medical field was very important. And, as I grew up and moved on, so what made was, moving into a different sector, not having a seat, getting a seat in an MBBS, because I goofed up in my 12th standard. At those times, it was like okay to decide what you wanted to do, and the families allowed you to really look at that. Though coming from a traditional family, so I chose to go to All India Institute of Speech and Hearing, Mysore, where we worked with children, adults having problems with speech, or needing speech therapy or audiology, hearing testing. And then I worked in the field for quite a while here, short time in Bangalore, then moved on to US, got my CEAS clinical certificate in speech pathology in the US. When we decided, for my family reason, my husband and I moved back to Pilani. And so there I did again contribute, worked with school children, and also worked and started and in a special school called Ramla Birla Kendra. And BITS was always there in the town, very big. And so they thought, a couple of people told me, why don't you go join with your skill sets? So I joined BITS with, as a, basic teaching on psychology and English and communication. And the whole idea from BITS was that I have to have my own higher degree, continue the education there, and become a full-fledged faculty. So, the whole idea was, what do I do in a technology and science institute? So one good opportunity that I got there was a work integrated learning, which offered MPhil in hospital and health systems management for doctors and people who were working in healthcare. So the BITS was very generous. I was very passionate about healthcare. So I joined that, and I think that was the best choice I made. And I continued to teach in the management area, and then did my PhD in quality management. So I was also teaching the similar program, and I was about to head that program. And then in 2010, for family and personal reasons, we relocated to Bangalore. So the choice was any general, MBA institutions to join for because I already had experience in that. But again, my passion was about healthcare, and I was very fortunate to get an opportunity to join Institute of Health Management Research at Bangalore. And so that, again, was a major decision. And so I started as an associate professor there, and became a professor. And in 2017, I had the opportunity to be a full director. So what has made me is, of course, a lot of your teachers and family, but the three institutions that have really made this possible. And I think here I am at IHMR as director and professor.
Ma'am, this is the reason that I have invited you to be a guest on our show, is that the biggest problem with the medico is that we are always taught a simple mindset is there: MBBS, MD, SRship, DM or MCH, and this is the life. And if any medico wants to, even divert for a second, the society, forces him to get back. No, it's not possible. MBA after MBBS, PGDM after MBBS is something which is, again, a lot of people think about, but it is still a distant dream. So, ma'am, my question to you is, like, anybody who fails a NEET PGA exam feels that, okay, my life as a medico has come to an end. You are saying that there are a lot of possibilities out there. How would a medico actually do well in an MBA or a PGDM program?
First of all, it's an important thought in terms of how the society looks at it, or how families also kind of think, their son or daughter is a failure, which is very unfortunate. But I'm sure, that is only the initial reaction for that. And there is only so much in terms of, getting a seat in, MD or MS or any of those is one part of it. So if you don't have, there are many other opportunities. So now, as we are looking at, the healthcare is really progressing in many different ways. So if hospitals now also need a clinical manager, maybe, hospitals also require people who are skilled. Medical profession or MBBS trains these young professionals to look at more clinical aspects, which is correct. That's what they're supposed to be doing. So they are, trained for diagnostics, treatments, and, look at each patient, and that's the focus of a medical doctor. But now, if you want to be in a field where you want to manage, so it is not just treating patients, but you want to manage the doctors, the specialists, the infrastructure, and then the patients, patient requirements, then make it much more, let us say, available for, and more affordable, as well as very patient-centered. There is someone else also who is required. So there is, this young medical professional who has understanding of clinical part, So he will understand how a doctor would respond. He will also know what the patient needs are. But what he needs probably is, how to work with teams. It's going to be a little different. I'm going to look at, processes. I'm going to look at turnaround times. I'm going to look at, how do I really manage this care is something that is probably new to them. So a PGDM or an MBA will prepare. And I'm sure we keep hearing a lot of this one that management is all common sense. And I think, yes, it is common sense. But then I also say it's also about special sense, in the sense I have to understand costs. I have to understand the important aspects of time. Time is also a cost. If I want to achieve more number of patients, I have to really see how I improve my processes. So these are, is common sense will help you learn, but it is a long shot. So you make a lot of error in this one. So I think an MBA really adds value. PGDM would really give them those skill sets. And as a clinician, I would have looked at only the patient side of it or the clinical aspects, which is correct. But then there is a larger sector and ecosystem. So a PGDM will also, kind of prepare them for understanding the healthcare ecosystem. Who are the players? How does this, pharmacy work? How does your medicines? Where do they come from? So you have, or like even like simple managing of your laundry, maybe linen, maybe so there is only some part of treatment, but there's a lot of hospitality aspects in a hospital too. So I think, that is what is something very important, and now as we understand healthcare is expanding, becoming big, there is ethical aspects of it, the aspects of regulation that is coming in. It's a highly specialized, highly technical areas other than the clinical one. So I think that's where a doctor or a medical professional would really, really be benefiting, so that he can really start contributing and managing various healthcare organizations.
You are mentioning MBA at one side and PGDM at a second side. So, what is the main difference between MBA healthcare and PGDM healthcare?
So MBA, it is more a statutory requirement. University affiliation has to be there. For PGDM, we are an autonomous institution, and therefore many autonomous institutions, like earlier even IIMs were calling it as PGDM. So it's more a regulatory requirement in terms of the nomenclature.
And what is the life for a doctor after doing PGDM or MBA healthcare?
There are a lot of opportunities. There is so much of healthcare growth that has happened. A lot of big hospitals, they are looking for, managing their operations, facility, in terms of quality and various areas if you're looking at hospital. And then there are, insurance sector, which is looking at, people really managing their claims, adjustments, and really being as a medical professional who can sign off. So a lot of the sectors do have opportunity for various roles, as clinical trained people, but then with a management professional. So there are a lot of opportunities across the sector. And now coming with the technology ones, the consulting firms, all of them have a lot of opportunities.
Don't you think an MBBS always has an MBBS student basically will always have a negative side to the PGDM life because they are not trained in maths, statistics, or economics?
Yes and no. They do learn, medical data is very important. They do learn, epidemiology and a whole range of subjects in their work too. And, what you require to look at medical data and biostatistics and others is basic mathematics. And I'm sure all our educational systems have provided for them. And there are two things in management. One is the biostatistics, the other is the money and the finance. So basic aspects of it will prepare. And as long as you have that aptitude for picking up on that, further you can build on even if you want to do like learn about high-end biostatistics and move on to AI and data interpretation.
Ma'am, what do you recommend? What kind of student should think of choosing management over the normal basic routine of MBBS and MD?
Okay, so one of the things that you probably have to really see is a doctor is always trained to think more in clinical terms. So if you think, yes, you can help a patient or a small number of patients, but if you think you can really be in management and help a lot of different people, scale is one area. But to be management professional, you need to be people friendly. You need to have a certain amount of interest in people to impact at larger levels, and you also need to be kind of more positively looking at really looking at. So any management professional would be looking at basic part of communication, an aptitude to really work with people, work with teams, be able to impact at that. And then now, of course, all across, we need somebody who likes to work with numbers.
Ma'am, every career path has one of the basic parameters to actually call it successful or a good career path, which is how much can a person earn in that career. Now, I would like to ask you, how much can a PGDM or an MBA healthcare professional earn immediately? What will be his first job after his post graduation, 10 years down the line and 20 years down the line?
Okay, so I'm sure many would be really curious. From the perspective of how the healthcare sector pays, our own, I will take one example where, based on our experience, about, starting salary would be around, a median would be around per annum. If I'm looking at, let us say, 2-3 years down the line, is when you really make an impact and a change. So you can move above, 10 lakh per annum. So if I'm really looking at 10 to 20, some of our own alumni, they are starting their own, companies, or they are, earning and heading organizations. It could be an insurance setup. It could be a hospital, as a senior manager there, or a COO. So there, I think the growth is unlimited as you really look at.
Ma'am, do you have postgrads, like people who have done their MD or DNB, then moving on to PGDM or MBA? Do you have those people also?
Occasionally we have people who have worked in the field and come back to us. They do come for, sometimes some of the short-term training programs. We have occasionally, like especially in the MD part of dental MDS, people have come and they have done our program. So not many of them post their MD will come, but they do come for additional short-term programs.
How long is the PGDM for? I mean, I missed that
It's
question.
a 24-month program. Yeah.
You have to come to the college and study.
Yes, but then within that we have 3 months of we call it as a summer training program, generally internships. So 3 months at the end of the first year, and then another 2 terms they do, and then the last 4 months they're already placed. So practically 7 months they are in the field.
Oh, I think you have seen the healthcare, you have seen the medical world and everything. What are the 5 basic skills do you think every doctor or paramedico, BDS graduate, everyone should actually know to survive in the upcoming 10 years of future?
Okay, so obviously one of the things is in terms of soft skills and communication, because you are going to work with, and along with that is the team work. The other is the data part. So a lot of data driven decisions are very important. As a doctor, a lot of the times we may depend on anecdotal, or even though a lot of the things have been researched and then come into a treatment part, So now there is more and more aspects of how to use data to make a decision as a manager. Use that and then bring your heart and feelings to it. So data analytics and then the other part is the technology. So technology adoptions and really knowing what is the technology that assists a good manager to really function. So those are 5-6 skills. And now there is also the aspects of consciously learning the regulatory aspects of it and consciously be very being a part of the ethical aspects.
So, ma'am, if I just talk about digital healthcare, AI, and future-proof skills, when we are doing the research for this podcast, we actually saw this number that 46% of healthcare professionals are unable to use digital patient data. I believe that's dangerous. What's your opinion about it?
It is. But then, why is that happening? So if 50% of the medical graduates are not able to do it, there are definitely reasons for it. Say, for example, medical professionals themselves, is it not that they have potential? They have potential. Are they not prepared? Maybe that is where, it is not happening. The other is the faculty and the infrastructure that is provided to them during their training. So there is important aspect of how the teaching or the teaching hospitals and how infrastructure is geared towards training these people, because that has to be very important. So therefore, but then those things are changing now. Slowly many of the people are looking at, but healthcare training, education, medical education is very traditionally done. So from analog to digital, it will take time, but then there is so much movement. People are ready for it. So patients are ready to use the mobile and for their health. So this will happen, and then there is a lot of approach that the government is taking to. So there is Ayushman Bharat digital mission. So the healthcare at the public health system is also using a lot of digital skills. So I think it's not going to be very difficult, but then there has to be concerted efforts across.
Ma'am, as a management person, what do you think that the Indian hospitals are lacking in their complete management and structure, which people abroad, maybe US or something, has already solved? What are the lacunas that you have seen as through the eye of a management person?
Yeah, I think with healthcare, no country seems to have solved all the problems. Healthcare is complex, so every health system is really trying and struggling to really build and innovate and do. For Indian systems, I think is the processes. Say, healthcare is not like buying a good in a store. It is, I go through a series of processes. A patient moves. So the process have to be really standardized. So they have to be managed much better. Because otherwise, if a patient gets stuck in one of those, then the rest of the patients waiting behind him also get stuck. So these are, very, very important in terms of organizing the care system itself and standard procedures, so that you can improve the volume and reduce the turnaround times. Yeah, so that would be very, very critical. And I'm sure we have worked with a lot of hospitals. If you ask any hospital on the discharge process, it takes a very long time. So
We are still living in a pen paper era. Right now, even most of I'm not talking about the private hospitals, but the government is completely working on a pen paper era, where the time for even a single decision, if I talk about discharge, it can take up to like 7 to 8 hours, where the caretaker of the patient is just roaming from desk to desk, asking ki kaise karna hai. And let's not even include the insurance part, because again, that's a whole another procedure.
oh yes.
Ma'am, you were talking about AI. Do you think in the upcoming 10 years, AI will replace the medical workforce in our country? Let's forget our country, let's say the world.
Eventually, robots or or the AI is not going to replace. The idea is not to replace. Idea is to help the doctors. At the end of the day, it is the doctor who will be really be able to treat. AI is in terms of reducing errors, in terms of making it faster. So it, based on the data, helps the doctor, enable the doctor to really take certain decisions. So I don't think it's going to replace. So that's not the idea, to replace.
Do you think that India can afford the digital healthcare dream?
Definitely. I mean, the whole way I look at it is differently. I mean, in the sense, India cannot afford not to look at the digital dream. We have already seen different kinds of solutions which have, are simpler. And, we saw during COVID, we really ramped up so many things. So teleconsultation, remote monitoring, getting the data for the specialists, because, you can't have specialists in remote areas, but you can transport the graphics and all the information, images, and then the, diagnosis can be done at a different place. So telediagnostics. So those are realities, and they are already happening. So I don't think, we should be thinking about, we can't have the digital dream. I mean, there is, from the Ayushman Bharat digital mission, from the policy perspective, to the people who are private sector people who are really, doing that. Because, getting the specialist trained is a long term. The number of who are required, say for example, we work with one of the ICU solution, Cloud Physician, and they are doing in managing ICUs in Ladakh to Northeast to various other places, and they are supporting the doctors who are there, nurses who are there, to manage their ICUs much better. So these are already happening. This is only will grow. So I think digital would be the solution, because in terms of scalability, coverage, as well as data-driven decisions for medical purposes would be the way to really look at.
Ma'am, as a director of a management institute, I'm sure that you have seen the startup world very closely. So let me ask you a question. Why does so many healthcare startups are led by engineers rather than doctors? Do you think that doctors are not equipped to be a startup founder or something?
Okay, so traditionally, I kind of find this question interesting. I always say Indian doctors were always entrepreneurial. They started their clinics, they started big hospitals. Look at all the big chains of hospitals. They all came as doctor projects. But now when we think of a startup, we think more maybe digitally or technology-based startups. There, yes, maybe the doctors haven't really done a major impact, because they are trained for more technical clinical aspects of it and not technology part. But that's going to change. Like I already spoke about Cloud Physician, it's a doctor led change. We also have other example that I can think of is what is known as Medisim VR. That's again a doctor led project, which is automating, which is changing the virtual reality, using virtual reality and simulation to train medical doctors on the clinical aspects, and nursing professionals on all clinical and various aspects of what they go through. So these will happen. Yes, they were. The training is always about clinical and taking care of the patient. So now both of that, so together. So whereas engineers are taught to get the idea moving and reimagine. So together, I think it will move ahead, because no engineering solution, however technically good, may not solve the medical problem. So it has to be with the medical professionals too. So now both of that is also happening.
Ma'am, what do you think are the three spaces in the healthcare system where new entrepreneurs, medico entrepreneurs, doctorpreneurs, whatever we call them, can actually think, okay, these are the three spaces that are going to explode in the next 10 years?
One is in the diagnostic aspects. So it has already come. So instead of having so many, gadgets, so many different labs. Now the diagnostic units are getting a lot smaller, and they you can have handheld ones that are happening. So one is the area of diagnostics. The other is area of AI solutions to, again, in terms of diagnostics as well as in treatment. So those two are the critical areas which will move. The other is the remote aspects of it. So teleconsultation, so whatever that system that you build, you can kind of expand it beyond the geographies.
Wow, ma'am, that's really impressive. The whole journey in itself. Ma'am, just to to let our audience know, what does IHMR actually does?
Institute of Health Management Research, we have a legacy from Indian Institute of Health Management Research in Jaipur of 40 years. So that is a very important one way back in 1980s, where people started thinking, and that was the time when a lot of medical colleges were built, hospitals were built, they were getting bigger. But Dr. Ashok Agarwal, one of the founding trustee, he himself is a doctor and an MPH from Johns Hopkins, and also a board member of Johns Hopkins Bloomberg School. At that time he thought entering into management and looking at preparing people for better achieve than just open another hospital. So, and then they moved south, and in 2004 IHMR started. So at Bangalore, and then we have what do we really work in? So initially it was all based on various kinds of research, capacity building, then the formalized program on the pioneers for management education for healthcare is from IHMR, and we are very proud of that legacy. And so Bangalore also has academic programs. We have PGDM, Hospital and Health Management, with 4 specialization: hospital management, health. Health is mostly with program management, NGOs, or people want to work in the government. And then we have pharma management introduced fairly recently, and then health IT. So those are the 4 specialization under the PGDM flagship program of hospital and health management. We started looking at, we have faculty who are PhD and others, and then they also need to be really guiding and their own area research and others. So we got an opportunity to really look at AICTE, and we started a fellow program in management, again exclusively for healthcare. That is 2 years back, and which is equivalent to a doctoral program. And then we have PGDM, artificial intelligence and data science in healthcare, which we started last year. So we have good accreditation for our programs. Then it's not the only thing that IHMR does. So the other key vertical is we support the health system, hospitals, NGOs and others to really look at how a particular healthcare program has to be implemented, what is the impact, how is it really making a change. So we take up a lot of research projects which are funded, and we also have empanelments with central government institutions like NHSRC. We write projects, and for ICMR, we take up large-scale surveys. Recently, last year we finished, NFHS is a very large-scale survey which is done across India. And the 6th round for the state of Tripura was taken up by our faculty and research officers in the state of Tripura for NFHS 6. So the whole state of Tripura was, kind of surveyed for various indicators in healthcare. We take up those different kinds of projects because government implements a lot of schemes for the health of the people. And so we do sometimes how to improve those programs, how to really see if they have impacted. So we take up assessment and projects. The other is also what we look at is when a new scheme or a new challenge has to be addressed, you can't implement a program healthcare program without piloting it. So we also take up, implementation projects. So if that results show well, maybe there is an opportunity for scaling up and so on. So we work with many international organizations on that, bid for the RFPs. We take up projects. So that's another key vertical. And then continuing with the professionals who require, they can't come for a full-time 2-year program maybe and so on. We take up short-term programs, like traditionally they're called like management development programs, faculty development programs, or certification, or now online, because people want to continue to improve their managerial skills. They could be doctors, they could be paramedicals, or they could be working in hospital as hospital managers, administrators at different levels, but they want to upskill themselves. And so those programs are also offered by us. And looking at the landscape as healthcare is moving, and also looking at where we are. Bangalore is known for IT. It also has a robust private and government health system. And then there is a culture of startup, and then the technology is, a lot of the technology is going to be deployed for healthcare. And for 3-4 years, we've been looking at what can we do. The senior management was also very visionary in, really pushing us to look at can we really have, something to go ahead on digital health aspects. And so we have started a center for advancing digital health, and we call it as Admire, where, management, innovation, research, and incubation can all be incorporated. From the last 3 years, we initially looked at it more organically. We now have, faculty, an engineer, ML engineer, a health informatic person, a program management person. So along with other, areas, we are, kind of really investing. We also have a digital data lab, which can help help the students also carry out various innovation programs and try out. So last year we started the program quite equipped, so to say, the PGDM AI and DS. And we are coming up with collaborative programs too, where these startups have already done various aspects of it. So we've taken also the collaborative programs.
That's great, ma'am. You're doing a lot of futuristic, crazy things in IHMR. And for the last question of this podcast, again, you might find it a little bit weird, but you have to list down the top 5 colleges for PGDM or MBA healthcare apart from IHMR.
The number one would be probably TIS, very traditionally, looked at. And then we have ISB program, ISB Hyderabad. The other one is also ASCII. Then many IIMs have come up with the programs, their brand names, and their programs will attract a lot of people.
So thank you so much, ma'am. But the podcast is not over yet. We have some rapid fire questions for you. Only 2 rules are there for the rapid fire. You have to be super spontaneous and super truthful. So, ma'am, my first question to you is Delhi weather or Bangalore traffic?
Oh my God.
And Delhi weather in the winters, not in the summers.
Oh, Delhi weather in winters? Yeah. Yes, I would not choose. I would choose Bangalore traffic.
One dish you can never say no to.
My favorite recent one is vegetable khichdi.
Okay. Favorite holiday destination?
Sikkim, Meghalaya, maybe Himalayas.
Yeah, Meghalaya is beautiful. What instantly lifts your mood?
Brisk walk outside.
Money or impact?
I think impact,
Ever Googled yourself?
Yes, I did. After one of the institutions called me for a Women's Day talk, I said, "How did you know about me?" And then they said we found out through Google. Then I Googled.
What's the last thing you Googled? And be honest.
Yeah, one is your address to get to this place for the recording. The other one is, I'm supposed to get an MRI done and I wear my contacts. So I Googled, is it okay to wear contacts when you get your MRI done?
All right, ma'am. Thank you so much for a very insightful discussion. Lots to learn about PGDM, and I think you have solved a lot of queries today. And I'm sure everyone who is looking to get into a new path after MBBS or BDS or a paramedical course will love every word of this podcast. Thank you so much.
Thank you. So it was pleasure talking to you, and hope this is going to be like a great learning for myself too, to really see how this is going to pan out.
Absolutely, ma'am. And thank you so much, guys. A new conversation, a new topic today, very insightful. PGDM or MBA, is it worth doing? Will you be able to solve the bigger picture, and will you be able to get digital healthcare into your daily task? So this is the thing that we have talked about, loved every bit. And before you go, do not forget to like, share and subscribe. मतलब थोड़े फॉलोअर बढ़ाओ, मजा आएगा और ज्यादा. So just kidding. Thank you so much. God bless you and best of luck.